This is John Walker with Sportsmed Orthopedic Surgery and Spine Center in Huntsville, Alabama. Today's video will show me performing a debridement, or a cleanup, if you will, of a triangular fibrocartilage complex tear. This is also known as TFCC wrist surgery. This is on a 53-year-old patient that presents with pain in the wrist. This pain often is over what's called the ulnar side of the wrist. It's often associated with popping, snapping in the wrist. The video begins with the scope in the ulnar side of the wrist, or looking ulnarly. As we advance it into the wrist, we see what appears to be a hole. A probe is placed to feel the hole, which actually are the edges of the triangular fibrocartilage complex. The edges are very loose and unstable. This is why most of the patients have the pain over that side of the wrist. We typically insert some sort of device, such in this case as a suction punch, and clean out or debride the edges of the cartilage. And the excess tissue is then sucked out through the punch. After the edges have been debrided with the punches and the biters, we insert what's called a shaver. This smooths out the edges of the cartilage. It also sucks out any of the debris. After all the edges have been debrided and shaved, a final debridement is performed. This catches any loose fragments that may be hanging on. After the debridement is completed, we insert a radiofrequency device that essentially further smooths the edges of the cartilage. After debridement is complete, we insert a hook or a probe just to make sure the edges are stable and that no other work needs to be done. At this point, the wrist scope is completed. We've debrided the cartilage, but in this case there was no evidence of a ligament tear or rheumatoid arthritis. This patient had no bone fragments and no bone spurs. For more information on this type of surgery and other upper extremity surgeries, please visit our website at www.sportsmedalabama.com. Thank you.